Hi there, I'm Wendy McCallum, burnout and alcohol coach and wellness expert, and you're listening to Bite-Size Balance, where everyday extraordinary women share their stories, expertise, and wisdom, all in the name of lifting each other up and creating a better life by design. Whether it's wellness, career, relationships, food, alcohol, mindfulness, hormones, or parenting, we talk about all things women's balance. If your life looks great on paper, but it still feels like something's missing, you're in the right place. Welcome to Bite-Size Balance.
Hi, everyone. Welcome back to Bite-Size Balance. I'm here with a really special guest today. I have Angela Fitzgerald with me. Hi, Angela. How are you?
Good, Wendy. How are you?
I'm great. So Angela was raised in Cape Breton by two shift workers. Her mom was a nurse and her dad was an electrical engineer. And she now works as a nurse with the IWK. You're in the neonatal unit, right, Angela?
That's right.
Yeah. And so here's how we came to do this podcast, because normally what happens is I think of a topic or I have, a specific guest in mind and I reach out and I set that up. Sometimes people approach me specifically or experts in their field. In fact, that happens all the time. Most of them are not great fits for the podcast. But what happened with Angela was really unique in that Angela and I have had conversations before around burnout, and Angela knew of me through some family connections. And she reached out to me because she saw a need in the group that she was in at the hospital for some support around burnout. And I can't remember, Angela, probably a few months ago that you reached out.
Yes, I'd say it was in the fall that we reached out.
Yeah. And so Angela was wondering what I might be able to do to help support the nurses on her floor and in her hospital. And we've been back and forth, and I asked Angela to try to gather some information as to what it was that the nurses were particularly struggling with. And she came back with lots of really great information that she'd gathered. She's been very thorough in her research. And so we have lots of detailed info, but what we really, at the end of the day, after talking, really realized is that probably the best platform for talking about these issues is in a podcast episode, because that way her group can access the information, but so can anybody else who is struggling with burnout in a caregiving profession. And I know there are so many people out there who are burnt out right now. And so many of them are in a field where caregiving is part of their job. Not all, but we do know that burnout is more common in professions where people are caregivers. So we thought, why not just do a podcast episode on this? So we're going to try to talk about this in a pretty general way, but at the same time address some of the specific questions and concerns that Angela has gathered from her team at the IWK hospital in Halifax. Have I done that justice, Angela?
That sounds really great.
Okay, perfect. So let's start out with this. So you're kind of a representative of the group. What's your role there? How did you come to start thinking this is something that is not just my struggle, other nurses are struggling with this too? And then what led you to be kind of the leader to reach out to me?
So I experienced my own burnout about a year ago with my youngest starting pre-primary and COVID. And I went through a really hard time and not really sure what to do about it. I started having really a hard time professionally and personally, just with balance. It seemed like my work life was mirroring my personal life. It was just intense all around, all the time. And I started looking around my unit and I kept feeling like I can't be the only one. I cannot be feeling like this. So I started finding my safe people and asking some questions. And it was really surprising how many people were burnt out over a year ago. And nobody knew how to deal with it. So then one of the nurse specialists for NICU wanted to form a nursing council. And she was asking for co-chairs to help her with it. And I came forward and said, I really think there's an avenue in the unit that needs to be focused on, and it's well-being of our nurses, because there is a high rate right now of burnout among our nurses, but we're not doing anything about it, nor are we helping them. And I said, I would love to take my focus from a wellness perspective as the co-host, and the other, the nurse specialist was going to co-host from a practical nursing side of it, the professional. So I thought that was a really great balance. And the first thing I thought was you, because I love your podcast. I found them very helpful. And you talk so specifically about the population that I'm working with. And a lot of your podcasts were very helpful. I referenced them a couple of times talking to these nurses who were burnt out. So through my journey of burnout and my daily evaluation of burnout personally and professionally, I'm really recognizing other people's signs. And I feel that the deeper we got into COVID and the more intense that our work became, you were seeing it very obviously where I felt that I wasn't seeing it. Now it's prevalent. And these nurses, we need help as nurses, not just NICU, but generally. And I feel like things are too busy in our profession to really focus on nurses. And it's starting to come out as just, burnout.
Yeah. And I mean, this is a big issue, and we're not going to solve the problem today. And we're not trying to solve the problem, but what we do want to do is we want to, the things I always want to achieve on this podcast, I want people to know they're not alone in this. And, today we're focusing in on nurses and other people in caregiving professions. You're not alone if you're feeling worn out and burnt out. And if you feel like the last few years have been harder than ever before. And we also want to get the conversation going. So we just want to start talking about this and open up the dialogue, because there's so much relief to be found in knowing you're not alone and to actually telling somebody else how you feel. And what you're struggling with. So that's my main goal with this podcast, is just to start the conversation and hopefully to let a group of people, whoever you are that's listening, know that you're not alone in this. So you mentioned COVID. Obviously, I mean, I can't even begin to imagine, Angela, how much additional stress that has added to anyone in the nursing profession. I mean, just as a parent and a business owner, there's been so much additional stress, but the level of stress that must be like layered on top of that for you guys is just, I can't even imagine. Like, what has it been like in the last couple of years to be working as a nurse?
That's a great question, because I feel like we were the first ones to go through this. Not a lot of other nursing generations would have nursed through a pandemic. Mm-hmm. Maybe definitely a long time ago. But what I thought of when thinking about this, there is an intensity to nursing right now. And based on that, a lot of that is fear of the unknown. Right. Because going into work every single day, you had no idea if you were going to be exposed. And then when we started all this, the exposures, you were waiting for that list at 9:00 at night or late into the evening to wonder if you were at the exposure sites. Did I bring it home to my family? And then you would start seeing some nurses starting to leave because they were on that list. And then you started thinking how unsafe you were starting to be by coming to work, but you're a healthcare professional. This is what we do. We're frontline healthcare workers. You had backup plans with your family. Okay, if you get this text from me, this is what needs to happen. Mm-hmm. Mine was, you'd have to go to your mom's with the boys for 2 weeks because I'm going to be in the house, or, a company was renting RVs that could put in the driveway. So the nurse or the doctor or any shift worker would stay in there for 2 weeks. Those are hard times because you probably could see your kids in the windows, right? That's really hard. There was also the uncertainty of like, could you trust what was coming in? So a lot of the times I was sitting at work wondering if this was worth sitting here as a healthcare professional when my family is at home and I'm the one going out into public, because this was back, when we first started the first isolation. My husband started working from home. The kids weren't in school. I was the one that was the risk. So that was really scary, because as a mother, I guess it's ingrained in you not to be that person, the one that's the risk one. Right. The other thing that I can say about the last couple of years, it's been really complex. It's just not straightforward nursing anymore. There's a mental health component. Now, we have some wonderful mental health nurses, but as my experience in the NICU, there's mental health, but not to the extreme that it has been in the last 2 or 3 years. Back in March 2020, we had to ask the support people of our mothers of the babies to leave. They weren't allowed anymore due to the restrictions that were passed down. The nurses that worked that day said it was the worst day they've ever worked. You have to tell a newly postpartum mother, your partner has to go. Yeah. Right?
And then presumably you end up having to fill that role for them.
Exactly. So then you're talking about professional boundaries. How can you keep your professional boundaries when you are their support person? Mm-hmm. Right? And then you think back then, when you were coming from other provinces, it was a 14-day isolation. So you're a fresh postpartum mother going into a hospital room for 14 days. The nurses had to go in full head to toe isolation gear. As a mother with younger kids, I remember those hormones, right? Those are powerful hormones, right? You're sitting in a room without a window, and I'm going in as your nurse, trying to be professional, but at the same time, being your support person. There's a lot of mental health in there that we're not used to doing. There's a lot of crisis intervention work that we were doing. And it was hard because you wanted to be present, you wanted to help them as much as you could, but there was a dependency there that was very heavy because you then went home again to your family who was under isolation, but you were carrying them quite a bit professionally. And that wasn't expected.
Yeah. And that would presumably, I mean, you're talking specifically about the NICU where you work, but that would presumably translate across for all nurses in that, in so many cases, support people were told they could no longer be there. So no matter what the floor, the ward is that you're nursing on, that would have been a really common, presumably a very common thing that nurses would have struggled with is having support people leave and then having to deal with their usual caregiving responsibilities as a nurse. But then on top of that finding that line as a caring person, but not going too far with it so that you've become the support person for that person who no longer has a support person. I mean, I can only imagine how challenging that is.
So then you were doing that at work and coming home to a family of potentially children, and they have questions about, why can't I see my friends, or you're homeschooling. Right. So mirroring intensities, mirroring the mental health end of it, there was no let up, right? And homeschooling, right? You were doing virtual learning. Well, so there was emotional support at work, there was emotional support at home. Even if you think about other outside of the NICU, nursing in general, if a support person wasn't allowed there for adult care, that adult was on their own. So you were dealing with a lot of very scary situations.
Yeah. So a lot of constant stress, and that it probably is significantly worse for women. I'm generalizing here, but moms, we know that women have had a harder go of it in this pandemic because of the fact that they're, not just having like the first and second shift, as we call it, but also the third shift. So first shift being their work, second shift being coming home and dealing with kids, third shift being managing homeschooling and education for large chunks of time during the pandemic, and all the additional stressors that we're having to manage of our children who are trying to live through a pandemic. So there's an awful lot of stress, and also, not just at the workplace, but also at home, and all of this is piling up. And then on top of that, you have the shift work nature of being a nurse. So talk to me a little bit about that, because that's something that we have not talked about specifically on this podcast yet. I haven't had a guest to come on to talk about burnout and shift work, but shift work adds a whole other level of stress. Physical stress, mental stress, and emotional stress to your life. So tell me a little bit about what that's like as a nurse.
So the biggest part of shift work as a physical stress is sleep. It is I think one of the biggest struggles of a shift worker. Me growing up with two shift workers, we were on a bungalow style house. My dad would sleep, and we were just told, play downstairs, your father's sleeping, he'll be up at this time. Don't make eye contact with him. If he gets up, just let him go. So we honored the sleep in our house. We were told that, our job is very important. Sleep clears our mind. Sleep makes us, helps us do our job. So I was raised with the importance of sleep. People, I don't want to generalize, but unless you work shift work, it's very difficult to understand how hard it is to sleep. And I've been doing this for 15 years, and I was a great sleeper before kids. And when my husband and when I went back to work after my first child, I told my husband, I have to maintain my sleep. My job is life and death. I have to sleep. So when I work, I can't be primary caregiver. I can't give it up. This is priority. And he understood that because he saw me without sleep, and a life with a lack of sleep is a hard one. Like, no sleep can make life really, really tricky. I know a lot of nurses who have a hard time sleeping, and they still function really well. So this is my personal experience with sleep. That's one of the biggest stressors, and then you put on a lack of sleep versus mom guilt, right? Because you worked all night. Your kids are home. They need schooling.
Yeah.
So you're going to sacrifice your sleep to help your kids, but then you're going out nights that night as well. So maybe you're going on 2 hours of sleep. So that was a huge one, I think. And if you put in the imbalances and the intensity of our work, I'm sure that made for a lot of restless sleeps, right? I don't think like really deep, comforting sleep is being done. Even without COVID, I think it's sometimes really hard to carry sleep.
Right. Well, so one of the things, sorry to interrupt, but I'm just thinking here, because one of the things, we talk about on this podcast a lot is that intersection of midlife and hormones for women who are in perimenopause and menopause. So anybody, kind of over the age of 40 is potentially in or about to enter perimenopause. And when your hormones start to fluctuate like that, that can have a really big impact on sleep. That's one of the most common, problems that women experience during their kind of perimenopausal and menopausal years. So I can only imagine that all of this on top of that. And then of course we have what you're talking about, which is the fact that stress creates more cortisol and adrenaline, and those things disrupt sleep. So if we're not managing our stress properly, I've said this, I think on other episodes, if it still feels like we're being chased by a saber-toothed tiger when we go to bed, why on earth would our body let us go into a deep sleep? That's just dumb, right? Our body is trying to protect us all the time. So if there's a chance we're still being chased by that saber-toothed tiger, and that's the message that our brain is sending, then our body is not going to relax and go into deep restorative sleep. So these days of additional high stress for nurses have probably led to, as you were just saying, even more difficulty getting good quality restorative sleep.
Right, exactly. Leading to so many more things. And if you're going out for one night shift, and usually the assignments stay the same for your night shifts. If you had a really hard night, you're going back out to it, right? It's your job. You go and you do, but you know what you're in for. And some nights you don't get breaks. It's the nature of the job, and we understand that, and this is why we do it. But yeah, it's like a snowball effect, right? The lack of sleep is just, and the health issues after that. The other thing for physical stressors, it's really hard to exercise, right? Especially during the isolation periods where the gyms were closed. Those with kids, all that stuff, that was another one that I found was really, really tricky. And then if you're not sleeping well, you're too tired to go and exercise. So you're pushing your body beyond. And we still are forging new routines in a new world of pandemic. So not only are we doing new things at work, we're coming home and forging new routines for our kids to make it okay, to make it as normal as possible. It's a lot of work on parents and nurses.
Yeah, absolutely. Yeah. So how have you seen the stress and burnout play out with your group? So what are the consequences that you're seeing of it, or the signs of it?
You're seeing a decrease in morale, for sure. You're seeing an increase in sick time. At least people, though, are recognizing if they can't do it anymore, right? Some of them are saying, mental health days or stuff like that. But a consequence to that is the nurses that are working are getting more patient load, right? You're seeing a lot more nurses kind of withdraw, come to work, do their job, and then go home to continue. And some people say, I come here, I do what I need to do so I can go home and have the energy to give it all, right? And that's not really, we entered the nursing profession to do what we love, and many of us are doing that. But that's what's the biggest consequences. But with the consequences came this band of nurses in every facet of nursing that recognized each other, or started recognizing each other and their struggles, and there was an increase in team support emotionally, mentally, recognizing a change in somebody's behavior, going up and being like, if you ever need anything. So that wasn't a consequence, but it was definitely a nice thing to see come out of all of this struggle, is recognizing the struggle is in others, but that was later on. That was probably the biggest ones.
That's so great though, that's happening. I talk about that a lot, this idea, and especially if it's coming from leaders. It's great if it's coming from your peers, but it's especially impactful if it's coming from a leader, and a leader is able to say, hey, I'm feeling this way. How are you feeling? Just giving people permission to share the fact that they're struggling and that this is challenging, because I mean, there's just absolutely no other way to slice this. This is an incredibly challenging time to be doing the job that you're doing, especially if you also have caregiving responsibilities outside of work, whether those are children or aging parents or both. There's just no way this isn't really, really hard for anybody who's doing this right now. So I'm glad to hear that there's conversation happening about that. But I would say, if you're out there, that you're listening to this podcast and you're struggling with this, and you're not in a place where there's a lot of conversation or dialogue happening about this, as Angela says, find your safe person first. So always start with somebody who feels safe, have the conversation, get the dialogue going, because that person has a safe person and they're going to talk to that safe person, and that person has a safe person. And this is how the conversation starts. And if you're in a position of leadership, consider the power of vulnerability here. Actually admitting, like, this is really, really hard. And I am struggling. And here are some of the things I'm struggling with. And here are some of the things I'm trying. What are you doing? What are you struggling with? How can I support or help you? So I love that that's happening. That's great. I do not love that there's all this burnout and stress happening, though. So you wanted to talk to me because you wanted to ask me some questions that you hoped I could maybe shed some light on, or, give some constructive strategies and ideas to other nurses who are struggling with this. So what do you guys want to know? What do you want to ask me?
So many things. I would say the first and foremost is, how do we know we're burnt out? How do we stop the cycle of burnout? How do we find time?
Yeah, it's a really good question. So it's kind of two parts there. So let's talk about the burnout piece. So the first thing I want to say is, I'm clearly not a health practitioner. I say this all the time on the podcast. I am not in any way a medical specialist or a health practitioner. And when I'm talking about burnout, I am not talking about depression, the mental illness that is depression. There is very often an overlap. People who are burnt out are more susceptible to depression, but people who are depressed are not necessarily burning out or in burnout, right? So they're two different things. They sometimes present together and they can look very similar. So before I talk about anything else, I want to say, if you're struggling with this and you're worried that you're either burning out and or you have depression, please go see a mental health care practitioner. Please go get some medical professional support to ensure that you're getting the treatment and support that you need. I'm going to talk about burnout, which is not a diagnosis. So depression is a diagnosis. Burnout is an occupational phenomenon. It's a phenomenon. And most often we talk about burnout in the work context. And the World Health Organization has recognized burnout as an occupational phenomenon, but I am always really careful to stress the fact there's also another type of burnout, and that is caregiver burnout. So that's the burnout that occurs when we are giving all of our energy to other people to take care of other people. Now, normally we're talking about caregiver burnout outside of and separate from the workplace. But in the case of nurses, for example, you are caregiving outside of the workplace, many of you, and also caregiving in your actual occupation. So I think that adds an additional level of risk when it comes to finding yourself in burnout. And we know that statistically, that people in caregiving professions are more likely to experience burnout. So what does burnout look like? Well, there are lots of different signs of burnout, and they don't all have to be present for you to be burnt out. It's just, I'm going to go through a list of them here. Just if you're thinking to yourself, "Ooh, I think I have like that. And yes, I have that. No, I don't have that." I always say, even if just a few of these things resonate and you're thinking, yeah, that's where I am, that's a sign that things aren't going very well for you. And, you don't need to be in full burnout to start taking steps to prevent yourself from getting there. And I really want to encourage you to prevent yourself from getting there if any of this conversation is resonating with you. So here are some of the common signs of burnout. Exhaustion's the first one: physical, mental, emotional. And that one usually shows up as the first sign for women. The second thing that happens is there's a shift in attitude. So people tend to go from like positive, glass half full place to more of a cynical, pessimistic attitude. And then another piece that comes with it is we call it like depersonalization, which is where you distance yourself. So for example, you might start distancing yourself from patients and being more clinical, less personal. right? When it comes to the care that you provide and the way you feel about both your patients and your coworkers. And oftentimes this leads to, you know, strained relationships at work and also strained relationships at home. So that's another sign of burnout. Decreased focus and productivity. When you're completely exhausted, it's difficult to focus and you are less efficient. That's just the way it goes. Not taking care of yourself. So starting to, as you were talking about, it's been so incredibly challenging for just the average person to sleep properly, exercise the way they want to exercise, and take care of themselves in terms of, you know, really healthy eating and that kind of thing, and stress management during the course of the pandemic. Additional complications for nurses there for sure. So when I'm talking about not taking care of yourself and meaningful self-care, I'm usually going to refer to what I consider to be kind of the 4 pillars of health: good sleep, joyful movement or exercise, healthy eating, and stress management. Those are the things that tend we start to see those erode when people are feeling burnt out. And then with that comes an unhealthy reliance on coping mechanisms that don't serve us. So tools like escaping using food or alcohol or social media or sometimes online shopping. There are a variety of ways that this presents, but we start looking for ways to feel better. And oftentimes tools that maybe served us okay in the past, when we start relying on them more and more and more, don't serve us anymore. So we see that a lot. And then just a decreased satisfaction with your life. So you're just not feeling happy and satisfied. And then, of course, at the very end stages of burnout, it can actually cause real physical illness. And also, as I hinted to, an increased risk of depression. So you can see like high blood pressure and diabetes, and just increased risks of many different health conditions as a result of this. What is burnout really? It's chronic, unmitigated stress, right? Which is also kind of the difference between depression and burnout, right? Burnout is very circumstantial. It is chronic stress that goes unchecked, does not get mitigated. Again, sometimes it can lead to depression, but it is a different thing. And so, you know, if I went through that laundry list and again, you thought like a few of those things or many of them hit the mark for you, then I would say it's worth continuing to listen to this podcast, because we're going to talk about some things that you can do to start, you know, getting mindful around this, and which is really the first step. So awareness is the first step in any positive change. So the fact that you're thinking to yourself, I think that this might be me, or I think I'm getting close, is actually a good sign, because it's a good thing, because you can't make change until you're aware that there's a problem. So don't panic, just keep listening, and we'll talk about some strategies and tools that might be helpful starting places for you. Again, we can't solve the problem today. And I encourage you to go and see a health practitioner about this if you feel like you are burnt out or burning out. But we will try to provide a starting place for you, at least today. So that was the first part of the question, which was, how do you know if you're experiencing burnout? Do you remember the second part of the question? Because I've talked for so long, I can't remember what it was.
I feel like maybe you answered it. Just to speak to your healthy eating habits, that's like a whole nother topic when it comes to shift work, because if you work night shifts, you're sleeping throughout the day, right? So my personal experience, I sleep from like 9 till 5 and I wake up by alarm. I have insane sleeping habits and I take nothing. I overslept for a night shift once because I set my alarm the wrong way in the 24-hour clock, and I got applauded when I like ran to work sweating 20 minutes late because I slept too long on a night shift. Right. The few dietitians that I've had I've dealt with when I was pregnant and just in the past year to help me eat better. Yeah. It was tricky to get them to understand that, no, I eat at 2 a.m. I eat at midnight. I have to, because my shift is 7 till 7. Right. And at 12 at night, you don't want healthy, right? Yeah. Yeah. So that's a huge topic at work as well, is what can I eat versus what do I want to eat?
So here's my suggestion for that, because I get that. And that happens more for somebody who's working shift work and eating at strange hours, but it also happens for people who are not working shift work and working regular hours, that they don't want to eat healthy. So they're just not interested in eating healthy for whatever reason. What I always say is, if you have it made and there, you are far more likely to eat it. So if it's actually prepared and you've got it with you and it's healthy, even if you don't want it, you're way more likely to eat it. If you don't have anything prepared and you have to now go choose it or make it, and you don't feel like something healthy, you're not going to eat healthy. That's the truth of it. So I would say, like, really simple place to start is just make a commitment to yourself that you're always going to have available a healthy choice first. And, committing to eating it before you eat something unhealthy is also a good strategy. So I can have that thing that I want that's not so healthy, but first I'm going to make sure I eat this. And then very often, once you've eaten that, you're not as likely to eat the thing that's not as healthy. So I don't know if does that seem like something that would be helpful, Angela, that strategy, or what's the...
I had to change my ways when it came to eating. With my first pregnancy, I ended up being gestational diabetic, which I'm wondering if there is a link due to the shifts in hormones and all that stuff. I'm not sure. That's just my own thinking. I also, throughout my career, have eaten the donair at 2 a.m. or midnight and suffered the consequences, and burned pretty bad, right? So I learned the hard way. Many nurses love it, and that's wonderful. But yeah, I have mine planned out very well, but I'm also a rule follower when it comes to, recognizing how my body feels. But yes, I think it's helpful. If that's one thing that people are struggling with, who are ever listening to this podcast, I don't have the energy to make, but if you plan ahead and have it ready, then yes, absolutely. I think that's easier.
Also, I would say, like, small. So the other thing that, we often feel like, the sort of conventional way of eating is 3 meals a day, right? Like breakfast, lunch, dinner. And I would say, if it works better for you to just eat mini meals during the course of the day, then that might be, if it's more palatable for you and you're more likely to eat the food if it's broken up into smaller meals over the course of the day because of your shifts and how your life, how you have to live your life as a result of that, then go for it. Because that's just something we've made up. That's a construct we've made up, this idea of breakfast, lunch, and dinner. The important thing is to make sure that you're eating regularly enough that you're keeping your energy levels and your blood sugar where it needs to be, right? So you want to make sure that you're eating and you're pairing some good protein and healthy fat with hopefully your fiber-full carbohydrates, right? So your vegetables, your fruits, your whole grains, and you're putting some good protein and fat with that. And if you need to do that with, 5 or 6 mini meals instead of 2 or 3 big meals over the course, that's fine too. Whatever works for you. You may need to experiment with this, but I can tell you that if you have made it, you are far more likely to eat it than if you have not made it. That is just a general human rule. So preparation is always helpful. Take those days where you're not working and get into the habit of putting one large recipe in a crock pot, for example, making one big pot of soup, like doing something that you can then eat over the course of the week. Maybe it's making some hummus and you don't even need to make this stuff. You just need to plan for it and go buy it. So it doesn't need to be homemade, but it's like, if it's not in your fridge, you're not going to eat it. So you've got to make sure it's there.
I also changed my perspective after having kids, that when I go to work, I get to eat what I want, and it's hot, and there's nobody picking at it. So growing up, there's some of my favorite meals that I don't tend to give to my family, or it's not for them right now. I make those and I freeze them. And sometimes at work, it's like pleasurable to eat by myself in the quiet, by myself with a book, or the only time I get to watch Netflix or something. I've changed my perspective on how I'm eating at work by putting an emotion to it or planning something that I normally don't eat.
Yeah, I love that. So that just ties right into what I want to talk about around the burnout, like the prevention of burnout, because really the antidote to burnout is resilience. And resilience is something that you don't just flip a switch and have it. It's basically the culmination of a big set of small habits. So you just start changing all of the little areas of your life where things aren't where they need to be. You start working on making change there. So again, it might be in relation to your sleep, your food, your your physical exercise, but it's also definitely in relation to your mental habits, to your stress management. And one of the things that I want to really encourage anybody who's listening to start thinking about is the fact that we have the ability as humans to actually move ourselves into the second half of the stress cycle, which is the part of the stress cycle where we actually relax and our cortisol comes down and our adrenaline comes back down and our body feels safe again, right? So when I was talking about that idea of like, our brain signaling that we're still being chased by the saber-toothed tiger, we can send the opposite signal. And it's really important if you're struggling with chronic stress to start putting in place some practices and some reminders to actually do that more often. And this is really, I said burnout is chronic unmitigated stress. This is about mitigating, right? This is about starting to actually consciously close the stress cycle and manage the stress that you're in that you can't control, right? There's a whole other topic, which is trying to eliminate and reduce all the stress that is within your control. And for nurses, a lot of that is probably not going to be job stress. It's going to be stress outside of the workplace and working on delegating and asking for help and, doing all of the things you can do to reduce the amount of extra stress that you have outside of the workplace. Work stress, a lot of the time, is not easy to mitigate. It's there, especially when you work in an acute care situation like you do, right? Mm-hmm. So that is a separate thing. But if we're talking about here about just getting into the habit of closing the stress loop, right? So we go into fight or flight when we're stressed. And if we don't close the stress loop, we stay in fight or flight, which means our cortisol and our adrenaline stay elevated. And those hormones cortisol in particular in large amounts, if it's left unchecked, is what becomes really damaging and leads to some of those physical consequences that I was talking about. So it's a really great idea to start reminding yourself of the fact that you need to you're going to have to physically signal to your brain when you're on a long shift. You're going to have to do this time and time again. And when you get home from a shift, I'm okay. Everything's okay. I'm no longer being chased by a saber-toothed tiger. It's okay to relax. It's okay to sleep. It's okay to let the cortisol come down, right? How can we do that? Well, we can do that by engaging in almost any activity that is incompatible with being chased by a saber-toothed tiger. I've said this many times on the podcast before. Anything you can do that you would not do if you were still being chased by a saber-toothed tiger is going to signal to your body that you're not being chased by a saber-toothed tiger, right? And it's okay to relax. So for example, taking deep, slow breaths does not happen when you're in fight or flight. It doesn't happen when you're being chased, right? In that situation, your breathing is shallow and more rapid. That's what happens when we move into fight or flight. So just the simple act of stopping and taking 5-10 deep, slow breaths is going to signal to your body that you're not being chased anymore. And it's okay to come down from the high that is fight or flight, right? Which is going to relax you. Same thing with having a conversation with a coworker, like sitting down somewhere with a cup of tea if you have a break and having a conversation with a coworker about something not stressful, right? About something else that's going on in your life. The reason I thought of this, Angela, is because you were talking about how you've made a ritual out of the meals. And so you take that as an opportunity, not just to eat, but also to close the stress cycle, right? By doing something that feels enjoyable and pleasurable, reading a book. You're not going to do that if you're being chased by a saber-toothed tiger. Watching Netflix, also not going to happen. There are so many things that we can do that will signal to our brain and body that we are okay and it's all right to relax. And many of them are very, very simple. Breathing is my favorite one because it's so accessible for everybody. And if you're struggling right now with stress and overwhelm, set an alarm on your phone to remind you to do it. Or get into the practice of taking some deep breaths, just taking a couple minutes to do some nice, deep, slow breaths in your car before you go in for your shift and before you leave the parking lot after your shift. Just that can in itself can help just bring you down. And a lot of people struggle with that transition time between work. And I can imagine that's probably even harder when you're on shift work, that transition between work and home. And so I do recommend that you create some kind of a relaxing ritual of sorts in the car, if you're commuting or if you take a bus or whatever, however you commute, something that is calming for you instead of something that's just going to pile on more stress. And for some of the women that I work with, that involves staying still in their car before they leave. And for others, they can do it while they're driving. So it might be listening to, a relaxing soundtrack. Or just for me, I love the quiet. So I'll just turn everything off. Sometimes the radio just adds too much chatter for me, and I'll just turn it off. I'll sometimes listen to the sound of waves on the ocean, like ocean waves when I'm driving. I just plug in my the app I've got on my phone that has all kinds of nature soundtracks on it. And I'll just listen to one of those. If you use the Calm app, there are lots of really nice, slow, calming pieces of music on there that can be really helpful. Or maybe you just take it as an opportunity to download and you call somebody and you just like get it all off of your chest. Journaling is another really helpful activity. Some people really love it. Some people don't enjoy it at all. But even if you just think of it as list making or downloading, really what you're doing is you're taking everything that's in your brain and you're just dumping it onto a piece of paper. And that can be really cathartic. And also, again, signal like this is over. And, this is a tool that I use a lot with stress management and anxiety. If you're feeling like you can't turn your brain off, you can either physically write down what you're thinking and then put it somewhere safe, or you can do the visual exercise in your head of like writing all the things down that you need to do and putting them in a locker, locking it up and putting the key in your pocket. So I can think about that later. I'm going to worry about that later, right? I have scheduled and saved time to worry about those things, and I've put them all on a list somewhere where I won't lose them. And so now it's okay to shut my brain off and actually relax. So that can be helpful as well. But this idea of closing the stress cycle regularly is really important, and I think can be very, very helpful as a shift worker. At the very least, doing it before you start and when you finish. So bookending your shift with something that feels calming, a simple calming practice. Could be 5 minutes of guided meditation, could be 5 minutes of listening to a calm piece of music, like I said, or soundtrack where you just focus in on your breath, or it could be breathing exercises, or so many other things. But those are just a few ideas that can help with that. And then any other time you can do that, like you're doing with your breaks, is just going to be even more helpful when it comes to managing stress. And then eventually you can start working that into your time outside of work as well. That's great because you've got stress when you go home too. Okay.
Just a note to your breathing exercises. I took a course back last year, and it was Mindful for shift workers. And you were talking about breathing exercises. So one of their exercises was identify a time during your shift that you're still, which is rare. But they said, so this week, every time you wash your hands, you were to take 5 deep breaths, right? Which I thought was really practical, very applicable. Before you write your big shift note, stop. Because if you have time to write that, you have time to breathe. And it was a challenge because it's funny how you don't realize that how much you are breathing or hyperventilating at work, right? Because your focus is never you, it's never inward. So I started doing that. Sometimes you have to push medications, 3 to 5 minutes, and you're standing there. So if, you could be breathing then, you could be breathing when you're going to the bathroom. I had certain bathrooms in the hospital that nobody really went to. So that was my spot. The other thing that I think, I can only speak to me, but I'm assuming I wouldn't be the only one. Your internal narrative when you're burnt out becomes very destructive, especially when you're on the job and you're feeling insecure as it is and burnt out, lack of sleep, whatever. Your internal narrative can be very, destructive. And mine was very hard to come over. And that was a lot of my burnout was I lost my control on it. And then somebody voiced it as a bully. Are you going to let the bully tear you down? And that's something that spoke very clearly to me. And I've gotten control over it. I'm kinder to myself. That bully has no control over me anymore. But it was hindering my professionalism because I never thought I was good enough for what I was doing. And I mean, this was 15 years in, right? And it took over. But I put that up to, that was burnout because I lost myself among that and let something else in me tell me who I was. I would think that would be not uncommon in work because you have a high standard to live up to as any nurse in any area. There's a lot expected of you. So that could be really hard on new staff and senior staff.
Yeah, it's really common. So that is really common. And I love what you did there, that idea of asking yourself, like, who is that actually that's telling me that? Is that actually me? Is that my like true authentic self? Is that the Angela that I know and love? Or is that another voice? And is that the voice of burnout? Is that the voice of the pandemic and the stress that comes along with that? Or is that actually me? And that can be a really great tool for shifting mindset, is paying attention to start getting, I mean, this is something I talk about a lot in coaching, the absolutely incredible value that there is in starting to become aware of what you're actually thinking every day, because so many of our thoughts are on a loop. So they repeat. I think it's like 90% or something of the thoughts that we had yesterday, we also have today, right? They're the same thoughts. And if you listen for them, what you'll realize is that a lot of them, the overwhelming majority of them, are negative. And so starting to identify that and then really consciously working on replacing them with something more positive is a really great step. Now you're probably thinking, well, what the heck do I replace it with? And how do I do that when that's my default, is to go for the negative? I really recommend a simple journaling exercise, which is, what would you say to your best friend or your sister or your daughter who is in the same situation as you? So for a nurse, it might be, what would I say to my coworker, Angela, who I love, if she came to me and said, this is how I'm feeling, and this is what I'm saying to myself, or this is what's going on in my life? What would I say to her? It's really very eye-opening when you start listening to your thoughts and you realize that you're talking to yourself in a way that you would never speak to anybody else that you care about. And again, like with everything, the first step is awareness on this. So I love what you did there. I think that's so great. And I also love the idea of having, setting up some cues to remind you to do the breathing. I think that's so great. I always use the example of red lights. That's what I started doing when I was working on trying to reduce my stress and just work more consciously at managing the stress cycle. I realized, I'm always really stressed out in traffic. And so I started, when I got to a red light, that would be like, it's almost like Pavlov's dog, when you ring the bell and the dog would salivate, it would give me a reminder to breathe. And I would start doing deep breaths while the light was red. And then when the light went green, I would move on. Another thing that I do, you got to find things that work for you. What makes you feel good? Hot water on my hands is very relaxing. So I will go into a bathroom if I'm stressed, whether it's at home or it's somewhere else, and I will turn on the hot water tap and I will hold my hands under it. I find that the heat of the hot water is really relaxing. And I love the idea of doing your breathing while you're washing your hands, or doing your breathing while you're, letting a drip run through, or whatever it is. So anything you can do to automate this, to remind yourself to do it, go for it. I mean, this is not, your brain's not thinking this way right now. And so you have to train your brain. You got to create some new neural pathways here, and using reminders and tools and tricks is great. So whatever you can do to remind yourself to close that stress cycle as many times as you can during the day is going to be really, really helpful. Okay.
It's a lot more challenging to do that. Cause like you said, you were creating a new pathway. It was a lot of work. I remember saying that, getting over the burnout and doing everything I can. It was a lot of internal work, a lot of paying attention. I don't think I've ever paid so much attention to myself other than when I was pregnant, and you're so internally focused on everything.
Right.
But yeah, it takes a lot of effort.
Yeah. And did you find that it got easier the more you did it?
It did. There are certain points where you lose your sense of self, but you come out of that, intense situation, and you remember again. I also found it very helpful in parenting, right? To be kind to myself. That internal bully was also very strong with the boys at the end of the day. But again, after, putting it into practice, and then I started saying to the boys, before we read this book, let's do 5 breaths. And they don't know, right? They're not knowing what I'm doing yet. Or I'll say, let's go to the beach today and we're going to clear out our lungs with these 5 breaths. I mean, they're 5 and 3, they don't get it, but I feel like I'm doing well by them and for myself.
Yeah, for sure. So we talked about some ways to close the stress cycle, but we haven't really talked about is this idea of trying to manage the stress, reduce the stress where you can. So I said there are lots of stressors that we can't eliminate, and that's okay. We're actually built for stress, and stress is not a bad thing most of the time. It's, it's what causes us to get stuff done. If we didn't have deadlines and responsibilities, we would not be very productive. So stress is not in itself a bad thing. It's when there's too much of it and it goes unmitigated that we have a problem. So
we don't have to worry about the fact that there is stress in our life. What we need to worry about is whether there's unnecessary stress in our life. So we have to start looking at where are the places where I'm allowing my cortisol to rise where it doesn't need to rise, right? Because for a lot of us, that's happening in like smaller stressors over the course of the week, and oftentimes outside of work, sometimes within work, but oftentimes outside of work, that are creating, a little bit of cortisol, maybe not as much cortisol as the big stressors we can't control, but all of those small things together, when you add up the amount of cortisol that they create together, can make the difference between you having like reasonable cortisol levels and unmitigated elevated cortisol levels, if that makes sense. So this is really this idea of don't sweat the small stuff. It's about looking at, okay, what is the small stuff in my life that I am currently sweating, that I am letting be a bigger deal than it needs to be, and that is actually pushing me into fight or flight. And this is hard. This requires mindfulness, and it will take you a while to figure out what these things are. But if you're listening to this podcast, I know that you know what it feels like when your cortisol rises. You know what it feels like in your body when you get stressed. Start paying attention to that. When is that happening? I've got lots of stress in my life, just like everybody else, that I can't change, but there are lots of areas where I have actively worked to reduce the amount of stress that's created, because I actually have a lot more control over that than I previously thought I did. So for example, I choose to not care about things that once I cared an awful lot about that caused me a lot of stress. But that don't actually matter, right? So Angela, this is one of the things you and I talked about before the podcast, this idea of like, could I care less? Could I consciously choose to care less about some of these things in my life that are currently causing me to go into fight or flight, that are just creating stress for me, which doesn't feel good in my body, which affects my mood, which affects my sleep, right? But which also has the potential to make me physically ill, right? So what are the things that I can choose to respond differently to or care less about? I always use the example of wet towels on the floor. That's my favorite one. Wet towels on the bathroom floor. I cared a lot about that for a very long time, until finally I realized nothing was going to change by me yelling about it every morning. And then I asked myself, what would happen if I consciously chose to care less about this? And I experimented with it. And what happened was I would just pick up the towels and hang them up. It would take 2 seconds, and then I wouldn't yell. And the whole rest of my morning and my kids' morning would go a whole lot better. And the truth is, by caring as much as I was caring, I wasn't actually making any change, because nobody was hanging the bloody towels up, no matter how much I yelled. So that's a really simple example of choosing to care less. And you can do that around the people in your life who, jack up your cortisol and make you feel stressed out. You can consciously decide to not let them bother you as much. And people will give me pushback on this all the time, like, oh, you can't do that. That's not within your control. And I'll say, no, it is within your control. You have to work at it though. Count to 10, practice pausing before you respond. And then there are lots of tools you can use also to manage your cortisol during the day. For example, technology is wonderful. Check your call display. And if the person who's calling you is someone who's likely to cause you stress, don't answer it. Let it go to voicemail. Listen to the voicemail when you have the time to listen to it. And then you have the time to formulate a response that's going to serve you, right? Same thing with emails. Turn off your notifications. Social media is a cortisol jacker. Turn off your notifications. Get rid of social media apps off of your phone. Try this. If you're someone who's struggling right now with stress and overwhelm, just take Facebook or Instagram off your phone for a week and see how that feels. It's going to feel good. I've removed Facebook from my phone a long time ago, and it's never going back. I don't miss it. I told everybody on Facebook that I would not be using it anymore for personal purposes. And if I didn't like or, comment on their posts, it was not a reflection of how much I loved them. It was just that I hadn't seen it because I'm not on Facebook anymore. And that gave me permission to just back away from it and to take it off of my phone. It's a relief to not have that there. So what are the small things in your life that are regularly jacking up your cortisol, and how can you take back some control over those things? That's a really great step.
It's true. My biggest one was after working 4 12-hour shifts, you're quite absent from, the caregiver role. So I was always trying to catch up and be like, okay, so when was this? When was this? When was this? getting a report. So I'm coming back into the picture now. So what am I doing? But I used to reset the house to my liking, which was after 4 shifts, you're cleaning basically. And then I had to start saying that to myself. Who cares about this house right now? Does anybody care? Or I kept cleaning up when the boys were done with something. But as soon as they left that chair, that meant they were done. Though my husband was like, but they're not done. Stop cleaning before they're even done. So I had to recognize the behavior behind my actions. And I started, the food was huge, trying to set a foundation of really healthy eating for my boys. But then that somehow I started making like, the meat and potatoes type of thing post night shifts. I didn't even want to eat it. So I had to recognize what it was I was doing. Who was I doing this for? And the boys are happy with like alphabets and butter toast. You know what? That's really good after a night shift. Yeah. So it's letting go of being 100% all the time. But again, I think that's part of, you're going from your job, you're coming home and you're attacking your home life with the same intensity. And you need to be productive at work because you got to get this stuff done for the good of the patients. And then you get home. Yeah. And for the good of my family, I have to continue to do this. I had to tell my husband when he saw me ramping like this, he had permission to stop my hands, because I would keep going and then it would go to the next thing and the next thing. And I would exhaust myself. Right. On lack of sleep. So I told him the behaviors and what it meant and then what he can do for me, because it takes a while, I find, to come out of nurse mode.
Yes, I can totally see how that would be the case. And I think what you're talking about is it's almost this perfectionist ideal that so many women identify with, which is just, by the way, my latest thing that I've been thinking about that I just want to know if anyone knows a man who calls himself a perfectionist, because I don't. I only know women who call themselves perfectionist. It feels to me like that is an adjective that only women use to describe themselves. And there is something behind that. We have been programmed and taught that our value is in our productivity and what we actually do and produce. And so we're not producing and doing something, it feels like we're somehow failing. And when we do produce, it needs to be perfect, which of course is completely unattainable and impossible. And that, I think, is what leads to that like constant doing mode that we find ourselves in. Here are 4 really great words for any busy woman. Does this serve me? Ask yourself that before you do anything. Does this serve me? Sometimes it's a balancing, like, what am I going to get from this cleaning versus what am I going to have to give up for this cleaning, right? Start to actually think about this as a balancing and a give or take thing. And, what do you need more of and what do you need less of? Also, questions when it comes to stress and overwhelm. What do I need more of in my life? What is missing from my life right now? What do I need less of in my life? And how can I let go of some of that stuff? And how can I bring in more of what I need? The last thing, Angela, I really want to talk about, because we're almost out of time. I mean, we could talk for hours about this. There's so much we could cover, but I really want to talk about the importance of working on increasing the amount of joy that you have in your day when it comes to preventing burnout. Because we talked about how one of the signs of burnout is that you start to develop a glass half empty attitude. You get more pessimistic and cynical. The antidote to that is to increase the amount of joy in your day. And the way that you do that, the simplest way to do that is to start a gratitude practice. And I know this sounds super corny, and there are probably all kinds of nurses listening right now saying, I don't have time for that. You do. It takes 1 minute. And this is why I'm such a fan of it, because it's such an easy, accessible practice. And what you're doing with an effective gratitude practice, and I'll tell you what that is in a second. What you're doing with an effective gratitude practice is you are training your brain to spend more time in the present moment, in the moment that it's in, looking for good stuff that's actually happening right now. And this is how you increase your joy, because your brain gets better and better at being in the moment that it's in. And that is where all the good stuff happens. It doesn't happen in the future. It doesn't happen in the past. It happens right now. But if your brain is constantly in the future, which is where so many of our brains spend time, so off in the future, trying to predict how this is going to go, thinking about what's coming next for us, instead of in the moment that we're in, we miss all of this joy. And that joy is really the antidote to the burnout. So what do you need to do to start an effective gratitude practice? You need to start writing down 3 very specific things that happen every day that bring you joy. And they have to be very, very specific. So to say I'm grateful for my family, my health, and my marriage and my job, those are not really helpful expressions of gratitude when it comes to reprogramming your brain, right? Because those are not referring to things that are specifically happening in the moment. So we want to make sure that the gratitude is for something that's actually happening, something we saw, felt, heard, touched, something that happened that was kind of cool and made us feel good. That's really what we're looking for. And the great news about gratitude is you can direct your gratitude. So if you're struggling right now with your job and you don't feel like there's a lot of joy there because it's just so hard and you're so exhausted and it's overwhelming and there's all these additional stresses and pressures, you can direct your gratitude at your work. And you can make it your goal to notice 3 small things that day at work that actually were kind of cool or nice. Usually it's moments of human connection. That's where gratitude is most easily created. So a connection with a coworker, a connection with a patient, or connection with nature. That's usually where I find most of my gratitude. And you can also obviously translate this over to your home. I mean, I encourage you to just be doing this all the time. And what you do is that for the first little while you do this is going to be really hard to come up with 3 things. It's going to be really challenging. The smaller, the better though. So you're not looking for massive things to celebrate here, just really small things like, oh, you know what? That other nurse squeezed my shoulder when she walked by because she could tell I was just right at the brink, you know, or it was just so sweet how that patient thanked me for helping them with whatever. Write those things down and do that for 30 days. It'll be hard in the beginning, but the more days you do it, the easier it will be. And if you need to set a reminder for yourself to do it, set a reminder, because this is not going to be natural for you in the beginning. But over time, what happens is the more you do it, the better your brain gets at looking for it. And before you know it, your brain will start noticing things before you tell it to look for them. And so you'll start getting signals back from your brain like, oh, this is really great that this just happened. Oh, I'm grateful for that. Or this was really neat. And you won't actually have had to do the work to actually find the thing to write down on your list. And you don't have to do it forever in terms of the writing down of it. What you'll find is that it kind of is like a snowball, and it just gets better and better. And I know this sounds like crazy, but I am telling you, please trust me. It is so incredibly powerful. And there's tons of science out there if you want to go research it around how impactful gratitude is as a habit. And it's really, really, really powerful when it comes to increasing the amount of joy in your everyday days, which is the antidote to burnout. So I wanted to make sure we included that today as a simple thing that people can start doing. You don't need a fancy journal. It can be a note in your phone, or it can be a piece of paper by your bedside table with a pen that reminds you to write it down before you go to sleep, or you can make it part of your practice when you have your coffee, that you write it down somewhere when you're doing your coffee. Again, reminders are great. So anything that triggers you or reminds you to do it is going to be really helpful, at least in the beginning. After 30 days, you can stop writing it down if you want to, or you can keep writing it down. It's also a very cool list to be able to go back to and look at on a day when you feel crappy, to go back and look at the things that you're grateful for that are actually there in your life. It can be a really great reminder when you're feeling like you're really struggling. Is there anything else that you really wanted to cover today that we didn't cover, Angela?
I think we covered a lot. I mean, like you said before, there's a ton that we could be talking about and we can expand further, but no, I think we did it.
Okay, good. We did what we could, and maybe we'll come back and do more. We hope that everybody who's listening got a lot out of this podcast, but especially if you're listening and you're a nurse, first of all, I just want to thank you for everything that you do all the time, but especially in the last couple of years. I love nurses. I say this all the time when I'm in the hospital. I always say it to the nurses because I have unfortunately spent an awful lot of time in hospitals, and I have had some pretty incredible moments that I am very, very grateful for with nurses. And I really appreciate what you do. And I know that the last couple of years have been particularly tough for you. And I thank you for that. And I know everyone else who's listening, who's not a nurse, thanks you for that as well. And I hope that you got something from this podcast that's helpful to you today. And if you have questions for me, or, topics that you'd like me to discuss, or ideas for other guests that I could have on to talk about the topic of caregiver burnout, please send them my way. I'm by no means an expert in this particular area. And that's why I was so happy to have Angela on today to help shed some light on the circumstances and what you guys are dealing with and have been dealing with for the last couple of years. So thank you so much, Angela, for, first of all, for bringing this topic to my attention, and then for helping me develop an idea for this podcast episode, and then showing up to be my co-host today.
Thank you for having me.
It was my pleasure. Talk to you soon.
Bye.
You've been listening to Bite Size Balance with your host, Wendy McCallum. As a burnout and balance coach, I help busy high achievers like you create a more balanced, joyful life. If you've been putting yourself last for way too long and are worried that you're burning out, grab your free burnout checklist at www.wendymccallum.com/checklist. That's www.wendymccallum.com/checklist.